So there we go. Good evening, everyone, and a very warm welcome to this session. It has been a few months since we held a free webinar. Happy that we are starting another series of webinars every Friday at 7:30 p.m. And this is in preparation to World Patient Safety Day. And every year, Cygnia Healthcare comes up with some activities to help nurses and nursing students to get more aware around this topic. So that's why our journey is called In Pursuit of Patient Safety. It is a goal towards which all are working together. And I'm so happy to see so many of you here today because you are passionate about patient safety. So we are also passionate about patient safety. Thank you for being here. So week one, the topic is okay. That's the welcome note for all of you. So today's topic is about the first topic that we are going to discuss today is the medication safety. So under that topic, we are going to briefly discuss about the global patient safety challenge, the story of the patient safety challenge and the medication safety challenge. What are the objectives and what is medication without harm? So that is the this year. Under the medication safety challenge this year, it is medication without, and we discuss about the severity of the problem, overall goal, and the framework for medication without harm. And what does this mean to? Now, the content of this is taken from the WHO documents. This is to help all the nurses and students. You are not going and reading the document all over again, and I'm going to make it easy to understand. So you spend an hour and we can learn together. So that is the purpose of this. So today we are going to discuss about the medication safety challenge. Now let's try to understand from where the medication safety challenge is coming. Way back in 2005, the World Patient Safety Alliance, that's a group of the entire world's countries together. After a lot of deliberation, I'm sure that many of you will remember this, that the first one, the Clean Care is Safer Care, which was launched in 2005. And that time I was in the hospital, so I remember doing activities around this. So that was the first patient safety challenge. And following that, 2008 came the Safe Surgery Saves Lives. And that's the time the surgical safety checklist was launched. And I am sure that many of you remember 2008 itself, many hospitals adopted this process of ensuring that safe surgery happens. So those were the two challenges. And the third patient safety challenge file, and that was launched in 2017. So when the safety challenges are adopted by WHO, they do a lot of work around this. So 2017, and we are sitting in 2022. This was supposed to be launched in 2020, and unfortunately the COVID came along, so everybody got busy with pandemic, so it got delayed. And now this year we have the medication without harm. Now, that's why this medication safety challenges, and this is the third global patient safety challenge from World Health Organization. And they have been doing a lot of, uh, knowledge building webinars from the beginning of this year, and I need to attend most of them. And I make time to attend because I do care about patient safety. And being a bedside nurse and then being a nurse and administrator, now nurse educator, I think there is whatever that we do around patient safety will always fall short. So World Health Organization has announced this third patient safety challenge to with the aim of reducing the iatrogenic medication related harm. And I'm very sure that all of you are aware of iatrogenic. Iatrogenic means it is coming from the delivery of healthcare. It is not intended, but through the process of care, we are harming the patient. So they are hoping that we should reduce this harm by at least 50% within 5 years. That is the intent. So there are three priority areas that WHO has, identified, and they are high risk situations where errors can happen. Then transition of care. Transition of care is when you are handing over the care to one person to another person, or from one facility to facility. So the third one is the polypharmacy. Polypharmacy, when patients are on multiple medications. So they have identified these three as the priority areas, and in the coming 3 weeks we will be discussing on these topics. The next one will be high risk, then transition of care, then polypharmacy, and they have all documents they have released on all these focus areas. And I will be deep diving into that and trying to make it easy to understand for all of us. And I hope that at end of this session each one of you will decide something to do, individual or as a academician or as a team leader or as a ward in charge or as a nursing head. You are going to decide something to change, to reduce the medication harm in your work. That's what I'm hoping. So with that, let's move forward. So WHO also has identified 4 domains of medication safety. So what are these domains that the WHO has, they have told that these are the four domains in which you can work around. That means, first of all, engage patients and public. That means to reduce the medication harm, it is expected that we engage patients and the public so that they become aware of their role in the medication and they can be a partner in reducing the medication error. Then treating medication as that all the safety features, the people who manufacture, the people who dispense, all the safety features are going to be built into it. And third, very, very important for all of us, education, training, monitoring of healthcare providers. It is not enough to say, I have trained the person, I have educated the person, but monitor whether the right processes are being followed. And the fourth, again, very, very important, looking at the systems and practices of medication management. Now, all nurses are trained, to give, and all of us know the 5 rise, 6 rise, etc. But there is a big portion of the healthcare lead expected to look into the systems and practices of medication management. As we deep dive into various topics, we will understand how important it is to design processes which are safer for everyone, the patients and the nurses and everyone. So we are not going to discuss much into the other aspects of medication. Most of the discussion I'm trying to keep it around nurses, because most of our audience here are nurses, and that's what we are going to do. Uh, so, can I request everyone to keep yourself muted, please, because this is important. Please keep yourself muted. Thank you. So now I'm going to run a short video. This is from WHO. Now, this is the call to action. There are 3 words that WHO released, and that 3 words will be showcased here, and then we will discuss a little bit on that. And this is a video that all of you can take it from the YouTube and show to your staff. Let me just play that. So, friends, that is medication without harm. And there are three simple words: know, check, ask.
Ask.
Now, this three words are not attributed only to patients. Now, we can reflect it on nurses also. First is that medication, it is mandatory that we know what medication that we are giving. Check before you administer the medication, you know the number of checks, etc. And that is what we are going to discuss in our last session on September 2nd. We'll be talking about safe practices by nurses, administration practices, so I hope that all of you will join us back on Friday to discuss the different domains, and let's reflect together how can we make our practices even more safer. Okay, so one is as we just discussed. So we are second one is check, and the third one is ask. If we don't know, ask what is this medication. Ask the patient that whether they know the medication. So it's a very good call to action that all of you use in your hospital. You can print out the WHO posters, put it around in the hospital, teach the patients, teach the nurses. Nurses just need to remember that I have to know the medication. I should check the medications. I must ask if I am in doubt, and I must ask the patient whether they know the medications that they are taking. So it is not that rocket science. Even WHO comes up with very simple, easy to understand, call to action. And that's what is very important and very practical for all of us to remember. It doesn't take so much of, high technology and high knowledge to ensure that we are safe with medications. Now, how do they come up with the global challenges? WHO, they secure very rapid commitment from all health ministers, professional bodies, regulators, health system leaders, civil society, healthcare practitioners. So, India is part of WHO, right? So, all the guidelines that comes from WHO, we have a spokesperson from our government who attends those meetings. And when WHO comes up with guidelines and white paper, it is being reviewed by that many countries, and then the final version is being released. So India is also committed to medication without harm. You must have seen some efforts being made by the government around antibiotic misuse. You'll be seeing more of it. Okay, then how do they come up with this uh, patient safety challenges? Because they do a evidence-based analysis of the problems and the solutions, and it's not happening just over even 1 year. So you can imagine the 2008, the second challenge came. The third challenge was announced in 2017, and we are working on it in 2022. So they do collect evidence-based analysis. That's why these documents are very powerful, because we don't need to go here and there to understand what is that evidence is talking about. So that's where your evidence is. And the invitation goes to all the member states and other relevant parties to pledge to sign up to address the aims of the challenge. And I really hope to meet all of you sitting here. You're going to pledge that I'm going to make mine or my teams or my departments or my organization medication process safer. It is worth the effort. Then high profile actions to generate passion and enthusiasm is done. WHO had been constantly emailing, having sensitization webinars. So it has been happening from the beginning of this year, and we all have been trying to attend and learn from that. And then they facilitate the implementation by the WHO Secretariat, associated experts, and advisors. That's why all these documents get released, and then I'm able to read and then share the same with all of you. And thank you so much for all of you being here. And then strong leadership and extensive internal external communication. So it is expected from the country country head. I mean, India is expected to show strong leadership, and external internal communication is expected from the government. I'm not going to talk about here about government or somebody else. What are they going to do? Let's discuss what is that I can do or we can do together, right? So WHO says all medication errors are potentially avoidable. It is not that they cannot be avoided. They all can be avoided. But how does medication error happen? It's because we are human beings, and to err is human. Knowing the fallibility of the human beings, it is very, very important that we need to pay extra focus and attention when we are handling medication, so that we care enough so that we don't neglect. We don't come with a plan that I'm going to neglect the process, but somewhere in my experience as the nursing administrator, I can say that, despite having the right protocols, they are aware of the right protocols. The errors used to happen because somewhere they did not follow the process. So my first call to action will be to all the nursing students and all the nurses sitting here, that why don't you pledge to yourself that I am going to practice the safe practices so that I don't make a mistake by mistake. I've been a bedside nurse for over 12, 13 years in critical care, and you can imagine the number of high alert medications that we will use in ICU. And believe me, every day for me, it was a challenge to pray and to be extra diligent so that I don't make a mistake by mistake. Now, that is something that we all ask everyone to mute yourself, please. Just give me 1 second. I will see if I can mute all. All right. I think that will take care of the sound disturbance that comes in between. So as I told you that, knowing that we are human beings and we can make mistake, it is very important to tell to ourselves that in an industry where our small mistake can harm the patient and sometimes even cause death. So we don't want that to happen. So that is what we should be mind. So it is also equally important for the leaders. The systems and processes, procedures they work with are flowed and functional. So most of the errors could be related to systems and processes. And in patient safety, all of us say no name, no blame, no shame. We understand, but believe, please, let's also admit this thing. We want the leaders not to name, not to shame, not, but there is something called individual accountability. You can't say I'm afraid to, report it because somebody is going to do something to me. Okay, organization say we'll not do anything. Please report. Because when you report, we learn more. But it's very important that we know the systems, we know the processes, we know the procedures. And many of you sitting here, if you have been a party or you have witnessed medication errors, there is always a problem that happened with the process or the which was incorrect. And sometimes the person has not been trained enough to carry out that medication process. When nurses work with high alert medications or high risk medication, it is important to ensure the nurses are aware of the medication, what they are handling. Sometimes that is not happening. Procedural steps are omitted by the person who is executing the process. Procedural steps are there, but somewhere they are missing that. So there is a possibility. Or the training was misunderstood. Sometimes the training is misunderstood, or the trainer, the way that it has been trained was not, understood correctly. So all the educators and academicians sitting here, there is a need for us to verify that, our learners have learned it, when we are teaching them medication process. Then, of course, poor communication and rushing to do things. Many times you will find that, rushing to do things can be the root cause of the error happening. So there are many human factors which are around a nurse who is making mistake. That itself is a class by itself. Knowing that, we can make mistake, I can only tell that, one need to be extra aware that I am not going to make the mistake. And I think three words that WHO has put out is something that we can use as a mantra: know, check, ask. All your nurses and students, and this can be applicable for all kinds of situations, not just medications, diagnosis also. Check and ask if you don't know. That's very, very important. So, why this has become a global challenge, and what is the severity of the problem? It's because unsafe medication practices and medication errors are one of the leading causes of harm and death across the world. So you can see that the quantum of harm that can be done to a patient will differ if you are staying in developed country or middle income or low income country. Though the cost of the medication harm is pegged at 42 billion annually across the world, it also says that low and middle income countries, the patients have double the risk of getting harmed by medication error. So, why do we talk about this number? So that we can appreciate the risk that we are exposing our patients, and we can appreciate the responsibility that we all have to ensure that our medication process is safe. And the harm done in low and middle income in our countries is that twice the DALI, the disability adjusted life years. That means we lose years because of the harm that is done through. So this is very, very important. Medication errors usually occur because of weak medication systems and or human factors. Now to start with, if we have a process which is very weak, then we are already planning that these errors are going to happen. The human factors like the tiredness of the employees, poor work environment, a shortage of staff, the multiple levels of transcribing, all the errors can happen at scribing level or transcribing level, dispensing level, and then the last one is the administration and monitoring. So you will see that as the last line, which is written separately by WHO, because that is where most frequent errors are happening is during the administration. And who administers the medication? I don't need to ask any one of you. And that is, almost always, barring in some special units, it is always the nurses who are giving the medication. So it definitely warrants that we need to take extra care to ensure that we are aware that there is a risk, and then we need to take care of that. So this is what WHO is talking about. If you have questions, please post them in the chat box, and then um, we'll try to answer the questions at the end of the session. Okay. So I am just repeating is that errors occur most frequently during administration. So it makes sense to work with the nurses and students to ensure that this is the most responsible job a nurse is doing when they're. So, what is the overall goal of this challenge? Which I already shared with you, to reduce the medication errors related to medication, avoidable harm to reduce by 50% in the coming 5 years. I'm sorry. The global patient safety challenge on medication safety is focusing more on strengthening the systems to reduce the medication errors. So systems include human factors. Now this is very, very important.
Oh, seriously.
I remember
Thank
that
you.
long time ago. I'm sorry, long time ago when my nurse had made a administration error. May I request everyone to mute yourself? Sorry. So the nurse, when I met her, she told me that I had 7 patients. So I was rushed. So I would say that, I only had one question to ask her. I said, I'm sorry that you had 7 patients, you were rushed. I'm really sorry. I throat. I only asked her one thing. Dear, did you ask for help? Did you tell someone that, sorry, I will not be able to complete my medication administration safely. I need help. But that was not done. So I will only request all the nurses sitting here, bedside nurses, students, getting ready to be nurses. Never feel afraid to ask for help. The most important is to be aware that I'm in a situation where I could harm a patient. I'm not able to complete this task. Maybe you have too many patients or something else is stopping you from, doing that procedure. Especially now we are talking about safely. Why don't you voice up? Why don't you speak up? Now this is very important. So first is know that I have a situation that I need to take care. Check yourself, um, whether I can complete this task myself or not. If you can't, ask for help. So listen, sorry, know, check, and ask. It can be translated into many different processes our nurses are encountering while they're administering medication. So our all the leaders out here, academicians over here, is to sensitize our nurses so that while the leaders have the responsibility to strengthen the systems, to understand the human factors, mitigate those factors, but personal accountability is something that cannot be written away. So now the challenge, the safety, medication safety challenge is improving, making improvements at each stage of the medication process, starting from prescribing to dispensing to administering, monitoring, and usage. So this is what the WHO is wanting to achieve. Now, objectives of the global challenge, and this is from the document itself. So there are 5 key objectives that they have listed out. So I'm going to explain that quickly to all of you. The first one is to assess. We are going to assess scope and nature of avoidable harm and strengthen the monitoring system. So almost all the work has been done by WHO at a global level. Now, at a local level, it is important for all of us to know how can I assess the scope and nature of avoidable harm and strengthen the monitoring system. So that will come through our error reporting system. And the most powerful thing that should happen is the near miss. And that is something that probably we all are not very strong at. We do not capture many near miss events in medication, and that can only come from the bedside nurses and the people who are at the bedside say it was about to happen but it was caught in time. Those are the events which is like the hidden under the iceberg, and they are the ones which can give you the way to plan and mitigate them in your system. So that is first is to assess the scope and nature of avoidable harm. Second is to create a framework. This framework has been created by WHO, which I'll be showing you in a minute. So that framework need to be, adapted and then interpreted for your own organization. They have done it at a global level, but each word is very important for us as an individual or as a leader or as a hospital or as a nursing department, each word becomes critical. Develop guidance material, technology and tools. I'm very sure even in each hospital there is SOPs, there are information materials, you are using HIS, there are monitoring tools available, and evidence-based tools you are taking from WHO and other bodies where evidence-based tools are available. So we are developing ours, sometimes we are adapting them to our system. So we are doing a lot of work around that. Engage. Now it is very, very important that, this is WHO telling the country, engage the key stakeholders, partners, industry to raise awareness of the problem and actively pursue. Now, I will not ask you to get into that. I would only say interpret it and say in your own organization, can I engage all the key stakeholders and partners in that process? When I do the root cause analysis of a medication error, do I sit just with the nurse involved and do a RCA? Do I also invite the doctor, the pharmacist, and the other people who could be involved in that to do a RCA along with the nurses? It's a question. You can think about it. If you are doing it, congratulations. It always has to be multidisciplinary. The errors don't happen solely out of nothing. The person involved definitely needs to be supported, but that was not the beginning and end of the error, because there are a lot of factors that could have led to that particular error at that time. So it is very important to engage. Now, last but not the least, what WHO is, all these words we have been using in nursing also, right? Empower patients and families and their carers to become actively involved and engaged. And I know this is one of the weak point in nursing medication administration also. Our nurses, they do not explain what medication is being given to the patient and to the family. This is the medicine that I'm giving. This is the action of this medicine. They can stop making a mistake. Now, this is very, very important to keep in mind. So, when I was a bedside nurse, I had this habit of, holding my medication chart and I'm telling that, my patient, Mr. Muhammad, okay, you have got 1, 2, 3, 4 medications you're going to get. The first one is amlodipine, 5 milligram. This is the medicine and this is for your blood pressure. The second one is Elastics tablet. Oh, this will make you to pass more urine. It also takes care of our blood pressure. So when I am reading, he is listening, he is double checking. And if there is something, he will also ask, the patient will also ask. The doctor said, he's going to reduce that Lasix. Then you stop for a moment, listen to the patient. Find out, did the doctor leave a order or did he mention but he forgot to write? Do I need to check with the doctor? This is very, very important in mind, right? So empower the patients and families and empower yourselves. Empower yourselves with the knowledge that you need to administer medication safely. I would always say never ever administer any medicine that you are not familiar. Ask someone. And it is very easy to ask someone. You just ask the doctor when he's prescribing, doctor, what is this medication for? What am I supposed to look out for? And nobody can say that doctors are not going to answer. I don't know. In my whole life, I learned the maximum from the doctors who are writing notes and prescribing. Immediately, I'll ask, this is a new medicine. Can you tell me what is this? And if at all someone tells me, why you are asking, I'll say, I am supposed to be giving the medicine. Don't you think I should observe the patient for effect and side effects? So can you please tell me? So nobody is going to say no to that. So my dear nurses, I will always ask you that empower yourself with the knowledge that you need. No knowledge of the medication, knowledge of the process, and the pitfalls of the process, how the mistakes can happen. So please empower yourself. Can I ask everyone to mute yourself, please? Thank you. So develop, engage, and empower. Involve patients. I think there is a lot that can be done in India to engage families and their carers. we are not doing enough. So this is very, very important. So this is the objectives as stated by the WHO document for the global medication safety challenge. So the 5 point action plan that is described by WHO is that take early action to protect patients from harm arising from high risk. So this is the priority that they have set: high risk situation, polypharmacy, transition of care. These are three topics that we are going to discuss in the coming 3 weeks. Then this is how the WHO went around making the 5 point action plan. Then they convened all the national experts, leaders, and they made guidelines and action plan for each targeted domains. And we talked about the 4 domains earlier. Okay, then put mechanism in place, release tools, technologies to enhance awareness. And while we are talking, WHO is already working on tools, and I will show you one of the tools WHO has already released for patients. And they have some plan to release a few more tools, but I'm not aware of any further tools that has been released. But for patients, it is there. So only if we know, we can tell our patients, no, you can download this tool and you can use this. I mean, it's an app that is, put out by WHO, so you can do that. Designate a national coordinator to spearhead. So there is one in the country. For us, that is not important. Can you have a hospital based coordinator who will take up this challenge? Will somebody volunteer to become a coordinator to work around this challenge and continuously assess the progress? So I think the member countries are expected to give WHO some reports at certain intervals. That's how the safety challenges happen. Now in India, we know that we don't have a very cohesive system where every hospital is giving information and then the government is putting it all together and giving it to WHO. It does not happen like that because we don't have one central portal where we are reporting all the medication errors. In US, when you go, there is a one portal where you can go and click and you will find what are all the kind of errors, which medications have more chances of errors, how it happened. So all those things you can find. But in India, can you find? Sorry, you will not find anything like that. So what is the WHO plan? WHO is planning that we should lead the process of change and global action. WHO will lead. We are going to follow the challenge framework, and they are going to facilitate the development and implementation of country programs. I would say that country programs are as successful as the bedside nurse. If the bedside nurse is, developing herself and implementing the right things, cumulatively that unit gets safer, that units get safer, the hospital gets safer, and many hospitals they start getting safer. That's how the country can become safer. Then the commission expert reports, and these are some of the reports that I am deep diving and sharing it with all of you. To develop guidance and action plans in each domain of the challenge, develop strategies, guidelines, and plans and tools. The ones which are available, I'll be sharing with all of you. And the research, international research and studies they are facilitating. Now it's important. Can nurses get into some study to understand how medication errors are happening? How medication errors can be mitigated? Are we doing enough, or are we just busy in our daily life and finishing one duty to the other? Hold regional launch events in each WHO region. So there was a meeting from the Southeast Asian region. There was a meeting which I had, attended. So that regional meeting also has been over. Create simple communications advocacy strategy, and which we already saw. The call to action is three simple words. I hope you remember those. Which are they? Know, check, ask. If we can remember these three things, I'm very sure that we can make ourselves safer and make others also safer. The patients and families repeatedly, the document talk about ensuring the patients and families and carers are closely involved in doing whatever that you want to do to ensure safe medication processes. Monitor and evaluate the impact of challenge. So whatever that you are, it is important that you monitor, continuously monitor and evaluate, is things working? If they are not working, why they are not working, what need to change, and mobilize resources for the implementation of the challenge. And these resources can be of varied based on which organization that you work. So I'm going to show here some of the things that the WHO has already released. WHO has released 5 moments of medication safety. Now, this is actually released for patients and families. Why don't you use this and start educating the patients and families? So this can be interpreted for nurses as well. Nurses also can think from their own perspective. What are my 5 moments of medication safety? So we all of you remember 5 moments of hand hygiene. So similarly, 5 moments of medication safety. The first one is starting a medication. One should know why the medication is started, what are the action, how should I be taking. So you should know that starting a medication, know, check and ask. Do know, check and ask at each level. So as nurses, when the new medication is started for a patient, know the medication. You should know what you're going to check as effect side effects. And if you don't know, you're going to ask. The second moment is when I'm taking the medication or when I'm giving the medication. You make sure that you follow all your rights, and we are educating the patient that before you take medication, you follow these things. Maybe the time, the dose, what they need to check before taking the medication. And there'll be some advice, if you're taking this, don't do this. So they have to take care of that. Now, the next major critical point is when you are adding a medication, and the same goes for our patients also. When you are adding a medication, very important to know whether this medication is going to have an interaction with any other medication this patient is getting, or the patient himself can ask that one more medication is added, or okay, this is for what purpose. So I will tell you another story. A patient was getting uh, patient was getting digoxin, and then the patient was added on beta blocker. So both of them can reduce the heart rate. Digoxin, it is different method of action. The beta blocker can also reduce, and this patient went into first degree heart block. So when I went for a round, I looked at the monitor and I said, looks like first degree heart block. And then they said, no, I think it's okay. I said, why don't we take a strip and measure the PR interval? And that's the time we realized the PR interval has become longer than before, the same day, morning ECG. So then I asked the doctor, let's look at the medication. So the patient had digoxin and beta blocker. So sometimes, combination of medication will not be safe for the patient. So it is very important to stop at that moment and see whether this medicine is okay. Does it have any interaction with anything else? Next moment is when you're reviewing my medication. When a doctor is reviewing the medication of the patient, many times it happens. My mother is the owner of a polypharmacy. She has got so many medications. Sometimes the doctor reduces something, adds something. It is very important. I watch for her, but you can imagine if she has to do it herself. It is very important. The doctor will say, okay, the BP is now coming down, just take off the beta blocker and keep the amlodipine. Now taking it off, and then you have to watch the BP, whether the BP is again going up or not. So there is things that need to be taken care, and all these things need to be taken care for the patient by the nurses in the hospital. We can only do that when we are knowing about the medication. What am I giving? Why am I giving? What is this medication supposed to do? And what are the side effects that I can look out for? And also the last one, the last moment is stopping the medication. Important to remember why the medication is stopped. Now I'll give you another story. A patient got admitted.
What I call it a challenge.
Patient got admitted for total knee replacement, non-case of coronary artery disease, and the patient had been on beta blocker for CAD and hypertension. Now, just before the surgery, doctor said hold the beta blocker because patient is going for surgery. So the medication was held and it was written there, held. Patient went for surgery. Patient came back from surgery. Somewhere it was forgotten that this patient needs to go back on beta blocker. Any medication that for angina, when you stop, we know that there is a phenomenon called rebound angina. Maybe for the 24, 48 hours, nothing will happen. Then suddenly angina will come. So exactly this is what happened in this patient. Patient suddenly developed chest pain, sweating. ECG was with changes. Fortunately, did not have a MI, and immediately the doctor realized, and we could tell the doctor that we have not started. So that's why medication reconciliation today is by far known by many nurses, but it was not known at least till 2007 or 8. And this incident that I'm talking about is much before that. So this is very, very important when nurses champions for patient safety. Nurses can tell, hey doc, with a blocker that was stopped, it is not started. Would you like to consider restarting it? But for that, nurse should know that why was this beta blocker given to the patient? What was the purpose of it, right? So we cannot be blind around, medication orders and medications. We have to make an effort to know the medication that we are using for the patient. Now, this app that I am showing you, this is how that app looks in the Google Store. You will find this app, which is called Medication Without Harm. And I would encourage all of you to ask I have downloaded it in my mobile. I thought, it can be useful for, nurses, but I found it is more useful for patients. They can keep their notes and it gives some, reminders for them to check on something. So this is around 5 moments of but I would request all of you to download this and have a look around this app so you will know where it is, and maybe you can start a campaign of educating your patients to download this and use this to make their medications usage far more safer. So please, I hope all of you have noted this, and please, at least one action. Today we are not discussing particularly of any particular moment or anything. We are generally talking about the medication safety challenge. So I'm giving this to you. So please download this from the Google store, and you can use this to educate your patient. Ask them to download and just teach them how to use that, so that way you are engaging your patient. There is one action item you can take from here. We are going to download this and we are going to, educate our patients to use this app, for their own safety. Now, who should act catalyst for change? Now, from the WHO document, these are all very big, big words, ministries and education institutions, regulatory authorities, healthcare professionals, society, patient advocacy. So this is from a very global focus. Coming down to a department, what would I say? Who would act as a catalyst for change? Each one of us. Each one of us can become the catalyst for change. It is very important. You can be the forerunner of showing other nurses that, it is worthwhile to know the medication. Maybe you will come up with an idea to suggest to your leader, this is how we can educate our nurses about the medication. There are many different ways you can plan, but there can be creative ways, so that people are not intimidated with that process. So please remember that everyone has a role to play in patient safety, and please call to action. Know, check, ask. Please memorize this. And every next week when you come, though we are not discussing the challenge per se, we are going to discuss the first focus area is that we are going to high risk situations. We discuss about high risk situations, and we should be aware that which are those high risk situations that we face every time when we are involved in a medication process. So this is important for the country, but from where we are standing, it is important to know that I can become the change. I can be the initiator of the change. So, as Mahatma Gandhi told, if you want a change, become the change. Maybe that's what you would like to. Now, this is the framework that WHO has given. It's a beautiful framework. It has got everything that we are talking about, in this one framework. So, I'm going to just deep dive a little bit into some of them here. So I would like you to pay attention to this green part here first. Healthcare professionals. First comes education and training. So our education and training starts from our first year. So medication process has got multiple prongs of safety that we are supposed to practice. When it comes to patient safety, when you are in first year, second year, I think first and foremost, I would like to tell any of the student is like a mantra. Have the right patient. Whether we are going to give mouth care for in first year, sponge bath or whatever, the gravity of risk may change, but I should have the right patient for the right task or the procedure. Similarly for medication. So it's a mantra, right patient every time. How do I identify the right patient? By two identifiers. So this is something that, it's not going to change. This is something that everybody should remember from day one in nursing till the time we are nurses. The second one is communication and teamwork. Well, I'm not going to give a lecture around that particular topic, but we know that communication is one of the top reasons for all sentinel events in the world. Look at the root cause of sentinel events, you in the top three. Few years ago, communication was right on top. Now leadership has gone up also. So leadership, communication, teamwork, all there are about 12, 13 reasons, but communication always remains as the top three. It is worthwhile to know that we have to learn how, when I can communicate correctly and concisely and completely. And when we discuss transition of care, we will be talking about communication at that time. Then capability at point of care. Now this is very important. When we are giving care to the patient, what is the capability of that healthcare professional? Whether it is doctor, nurse, GDA, it doesn't matter. Whoever is caring for the patient, are their capabilities matching the skill? Is the right skill being matched with the patient? Now, for the medication safety challenge, incident reporting and learning is very important. I would like to emphasize on learning. I always complain that we are not very strong in learning from our own mistakes because we don't like to share, first of all. If even within one hospital, one unit will not like the other unit to know there was a patient there was an error that happened so that we can learn. It is very important. I think it is just being smart when you learn from somebody else's mistakes so that you're protecting your system, yourself from committing that mistake. So when you read in the newspaper that, oh, this is what has happened in this hospital, do you say, oh, they did like that, they are supposed to be like that, or you are going to say, I'm going to look into my process because this can happen in my hospital also. I'm going to check my processes. Now, what kind of thought process come to your mind when you hear the errors? Just don't hear and find a fault with someone and say, "Oh, it happens there." Please remember, it is not always happening there. It happens with us at any point of time. So it is very important to know that incident reporting and near miss reportings are very, very powerful. Now, coming to the medicine itself. Now, look at the medicine quality and safety. Okay, now nurses, I would not say there's a direct implication on that. Naming, labeling, and packaging. When it comes here, naming, labeling, packaging is actually for the pharmaceutical companies. But when we look at our own systems, how do we store them? How do we label them? How do we label the high risk medication? How do we label the LASA medications? Why they are being told to label like that, and what are we supposed to do around that? So we should know that, it's very important to focus on that. Logistics, storage, and disposal. Now we should know how medications are being disposed. So every single word here has got an implication to nurses directly. And you can interpret that at government level, pharmaceutical companies level, doctors level, nurses level. My job here is to make it more relevant for nurses. Now coming to the right product at point of care. So having the right medicine at the point of care is important, right? Every nurse, they have the right to get the right medication for the patient. Now always like to remind only one thing, my dear nurses, you are the last defense. You are the last person standing near the patient. You are the last warrior who can stop any harm coming to the patient. So do we take that responsibility? We can only take the responsibility if we have the knowledge and we are aware of the situation. Then we can stop the harm reaching the patient. Maybe the wrong medicine came, but you not give the medicine because it is not the right medicine for my patient. You can stop it from happening. Now, systems and practices of medication, monitoring and evaluation. I don't have to talk more about it. No, I should start from top. Systems, leadership and governance. It's very important to have the leadership and how you govern the entire medication process is prescribing, preparation, and dispensing. So all of them are interconnected. There is always a chance when we look at something like this, we find a problem with everyone else. We will say, oh, the doctors don't prescribe it properly, they don't prescribe it fully, the medication does not come on time, the pharmacy does not give the right medication, doctors write all kinds of medications, and I have too many patients, I am too busy, I cannot monitor. So you can come up with all these excuses. At the end of the day, I will only ask, what is my personal accountability, responsibility? You may not be able to do everything. As a nursing head, I always used to ask my nurses, please shout. You need help, please ask for help. And if you don't get my number, call me, let me know that you need help. But don't go ahead and put yourself in a dangerous situation where you will make a mistake. That is my humble request to all of you, that please take personal accountability. All these things will happen, and when you are aware, as you get into leadership position, you will start thinking more strategically, more globally, to say that in my hospital, how can I make the medication process safer for my nurses? How can I make sure that my nurses are not disturbed during the time of administration, that I'm not going to call her, hey, your doctor has come, go for rounds? I think that's wrong. So we need to think about these things. So that's about the systems and practices. Then coming to patients and the public, involvement of patient organization. We don't have many patient organization. In abroad, there is lot of bodies for patients and families. Patients for patient safety. In India, there is a small initiative that has started. At least two I know of. One is under the umbrella of WHO. I think Dr. J.S. Arora. Another one has been initiated by Kaho. So it is a beginning. Now, is there a place where patients can report adverse reactions, any problems with medication? We don't have a portal as of now. But what can we do when they are under our care? Engage them, educate them, make them medication literates. That's what public awareness and medication literacy. Teach them how to use their medication safely. So let us, looking at this framework, let me call out to the academicians, nurse leaders, unit managers, and team leads and bedside nurses. Each one of this role here has got something to do to make the medication process safer. And this itself will take another 1 hour of discussion. But I hope that all the topic, all the domains that we discussed, you're able to kind of relate to it. I will only say academicians have to ensure that nurses they understand this responsibility, the students they understand this responsibility completely to say that they have to know the medication, they have to check, they have to ask if they don't know. Don't just don't just go and give any medications. Nurse leaders get into designing safe processes, make a channel to make sure that you are aware of all the loopholes in the processes that can happen. So very simple example, when I look at some errors, I try to think about it, how can you mitigate it? Maybe getting the doctors to write directly in the medication chart is one simple way of reducing transcription errors. When you're not transcribing, there will be no transcribing error, so the doctor is writing directly into the medication chart. We need to champion it. We have to talk to the doctors to say that this is for the safety of the patients, not to make the nurse's life easier. I'll tell you a reality in my from my own experience. Whenever you are arguing for the patient's safety, usually the pushback is not there. If I'm a nursing leader, if I'm going to talk to the doctors, my nurses are wasting time writing the orders again, so please write it directly. It will not ring a bell. But if I tell the doctor that we want to work towards patient safety because we want to avoid any transcription errors, and the doctors they need to write anyway once. So why not write directly in the medication chart? I know of some organizations who have redesigned the medication chart where the medication very clearly needs to be written in capital. The route is written. Any special thing, any special considerations are also being written by the doctors. So let me tell you, the younger doctors are far more willing to be your partner and make things safer, because they have not been used to the old system. So they are willing to learn the new system. So maybe that's where we have to work with our doctors to ensure. So, like this, process changes will actually become the responsibility of the nurse leaders. And nurse leaders will know this only when you have a dialogue with the frontline nurses. Very important to call them and say, hey, what do you think that we can do to make your medication process safer? And don't just go for, you should have, more open-ended question asking that, what can be done? How can we make it more safer? Unit managers and team leaders are right in the middle of the battlefield. They have the maximum information what is going right and what is not going right. Why don't you become the champions? Why don't you talk about how we can improve? Maybe tomorrow you would like to take out the WHO call to action, print it out in color and start pasting, say that we are going to now know our medications and check our medications and ask if we don't know. Educate patient, know your medication, check your medications before taking, or check us before we are giving the medication, and ask us if we have not explained to you enough. Many different ways this can be it for our own consumption, and that is what I hope that all of you will do when you leave from here. And bedside nurses, I have only one request, again same three words: know your medications, know their effects and side effects, what to monitor, what I should do before giving the medication. Check the We will be talking about how many times the nurse can check, self check, in the last module. We'll be talking about high alert medications in next Friday, so we'll be talking about that. The last but not the least is ask. If in doubt, please ask. If you are in trouble, ask for help. This is my humble request to all the bedside nurses. Be confident to speak up and ask for help. Why are you asking for help? Not because you are lazy, because you are smart enough to understand that I have enough on my plate, and now if I get into this, I could make a mistake. Don't always expect somebody is going to recognize that you are tired, somebody is going to recognize you're going to do this, somebody is going to recognize you have too many patients, or you will make a mistake. It need to happen. I am not saying it should not happen. It is the leaders' role to do that. But the young bedside nurses can make it happen when you start asking. That is called speaking up. Speak up for patient safety. Have that confidence. You will have that confidence when you're aware of the human factors. These are the things that can lead to medication errors. And we know that. Now, let me give you the very simple example. I always used to advocate that nurses should not work when they do double duty more than 12 hours. If you are doing 18 hours, I can guarantee that you will miss something. It is not necessary, it will be always a medication error. There will be some missed care is gonna happen because your brain will get tired. So don't opt for 18 hours of job. You can't say I can stay awake for 18 hours and do duty. You cannot, because our job is to have an active mind for our patient, right? We are critically thinking all the time, and we are deciding something for the patient. To have that critical thinking, your mind needs to be alert. And also, one responsibility, when you report on duty, please make sure that you are hydrated and you have eaten your food. We know that when we become low in sugar, our brain will become foggy. So, would you like to have a foggy brain when you're looking after your patients? So, some basic, discipline in our life is very important. I'm a critical care nurse. I think many, 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 many years ago, one of my senior told Thankam, always eat and come for duty because you never know whether you will get time to drink a glass of water or even go to the loo. So as a critical care nurse, I learned how to hold my bladder for many hours. But I never stepped out from my hostel without eating. But in my own experience as an administrator, I have seen nurses who will just get up 15 minutes before the duty, just freshen up and come straight for duty. And immediately after starting the duty, oh, we need to go for breakfast. Or they are after few hours, oh, they are so weak, they are going to faint. Somebody has to look after them. So let's take our own responsibility because we are doing a great job to the humanity. We are looking after sick people and making them well with our care. When I am giving these little tips, it does not mean that everybody is doing it, but I have seen this happen with our nurses. So, this is very, very important to keep in mind. The last call to action to all of you is before giving the medication, know your medication. This is from WHO. You can download it from the net, post it everywhere, and educate your nurses. Check that you have the right patient, the medicine, the route, dose, and the time. We know that. We know our five rights. Ask your patient if they understand. And if you don't know, see, it is kind of assumed by WHO under that one bracket that healthcare professionals should be trained and they should know what medication. But I will tell, knowing our nurses, ask first if you don't know the medication. Then only you can educate the patient and ask the patient, have they understood? So now, please remember teach back. I would like to remind you about teach back. When you ask your patient, so I'm going to tell the patient, okay, you're going to take, this is the tablet for your blood pressure. This is your, metoprolol. Okay, you have to take 3 times a day. He'll say, okay. How will you know that he really know that he has to take 3 times a day? The only way to confirm is ask him to teach back. I can say, sir, can you now explain to me what I told you? When he is able to tell you the right way, then you know the learning has happened. I really wish that in our education scenario, we can always do this teach back methodology. It is not always possible to do that. So before I wrap up, I want to show you one more video. This is a nurse from Canada, and now he is the president of Canadian Nurses Association, reflecting on an error that he made when he was a young nurse. We will not find such videos in India, unfortunately. So I'm going to play that video for you, and then I'll close up with my last words. And I will be looking at the questions. If there is something, I will be answering them.
to share a story about a medication error that I made more than 30 years ago. And even though more than 3 decades have passed since that day, it feels like every moment of the time is ingrained with crystal clarity in my mind. And I hope by sharing it to share some lessons that other health providers can learn from. I'm a registered nurse, and I was practicing in a neurosurgical intensive care unit back in 1985. I had been a graduate for about 2 years at that point, and had moved from a ward setting into an intensive care unit. And in that setting, which means he should have any more potassium given to him. And the second patient had low potassium, and they were in bed side by side, and I had those two patients through the day. Through a series of errors, I ended up giving medication to the wrong patient. The physician called about the patient.
Sorry, you are not able to hear the audio. Sorry about that. Are you not able to hear the audio?
No, ma'am.
Lot of
Yes.
interruption, ma'am.
Lot of interruptions. One second. Let
Yes,
me.
ma'am.
No, we can't hear.
One second. Let me just play. This is an important video. Okay, let me just play that again.
I'm here today to share a story about a medication error that I made more than 30 years ago. And even though
Can you hear now? Can you hear now?
Yes, ma'am.
Okay.
more than 3 decades have passed since that day, it feels like every moment of the time is ingrained with crystal clarity in my mind. And I hope by sharing it to share some lessons that other health providers can learn from. I'm a registered nurse, and I was practicing in a neurosurgical intensive care unit back in 1985. I had been a graduate for about 2 years at that point, and had moved from a ward setting into an intensive care unit. And in that setting, the pace is fast, and I was fairly new. I'm going to say I was there less than 6 months in that setting, and was so impressed with the rapid thinking, apparent intelligence, competence of the nurses around me, and you want to be like them. So I think when I think back to what happened, I do think some of it was trying to be better, faster maybe than I was. So on the day this incident happened, I had 2 patients, which was normal in that unit. And the situation of the 2 patients I had was that one had high potassium, which means he shouldn't have any more potassium given to him. And the second patient had low potassium, and they were in bed side by side, and I had those 2 patients through the day. Through a series of errors, I ended up giving medication to the wrong patient. The physician called about the patient with the low potassium and transmitted a message, an order for a potassium medication to go to that patient. Gave this order to the nurse in charge at the desk, so I didn't personally have the conversation. And she wrote the order, which is normal. We call that transcribing. She wrote down, give medication X to patient A. And in the course of calling me to the desk to tell me that this had happened, she held up the order sheet. And nurses and docs and people in hospitals will know there's usually a little identifier on the corner of the sheet. And she had her hand over it, simply picked up the paper and said, here's the order, which is a normal thing you would do. Give it to patient A. And I, wanting to appear competent and to act quickly, it's a critical care unit, drew up the medication and then failed to do a really important thing, which is to cross-check the order, which had been shown to me. So remember, I had seen it, so I thought, okay, that makes sense. And I knew the patient had low potassium, so it all made sense. Went to the bedside and checked the patient, made sure I had the right patient, which I didn't, and because I was rushing. So I took the medication which I had drawn up, potassium, and was about to give it to the patient. And this was a big lesson for me in my entire career. I thought something was wrong. I thought something was triggering me. Something's wrong with this. What I didn't do was stop. I pushed it in. Slowly, but pushed it in. And I wasn't 2 seconds after I finished, I thought, oh, it's the wrong patient. It's the guy with the high potassium that I just overdosed with a whole bunch more potassium. And I just thought, literally I nearly collapsed. And when I thought, my career's over, I'm not going to lose my license, he's going to die. And I, to this day, don't know why I didn't stop, when in fact what had happened was everything in the chain of events had been done correctly, except when she said, give it to patient A. She was wrong, because it was for patient B. Her hand was covering it, and I didn't look at it, and I didn't double check. Are we talking about patient A or patient B? I just said, okay, I know I've got this potassium problem. Went over, shoved it in. To add to the complexity, it was a physician himself, the patient was a physician, known to other physicians. I don't totally remember, but I think someone took over the care. It's the only part that I can't remember, because I think I was so upset that they basically put me in the staff lounge. And I think I spent the whole evening shift there just waiting and wondering, because I couldn't go home and rest. I thought, he's going to die. And I knew that I had pushed it in. It's 32 or 33 years ago that happened, and it is still cemented in my mind, everything about the lighting in that room that day, the look of people around me, how I felt, what I learned about, when the little man on your shoulder says, slow down, you should slow down before you hurt somebody. And I always tell that to students and other nurses, just take that 1 second. Don't complicate the situation by rushing that way. In this case, it's a perfect example of what we see often in medicine and nursing, which is the errors happen at points of handoff in care. We see it from docs to nurses. In this case, the doc to the charge nurse to Michael, and all capable people, right? In a rush. Not unusual to have a mix of very, very sick people side by side, and part of your duty as an RN in a critical care unit is to have that in mind. Each patient might have 5 or 6 or 10 lines of medications running in. That's part of the job. I think that a complicating factor is when physicians give orders to some intermediary person. So right away you have the potential for an error, which happened with us, just the wrong patient. Everything else was right, except the words came out of people's mouths wrong. We see it in handoffs, even in home care, from registered nurses who provide plans of care and delegate care to a licensed practical nurse, who may delegate that to a nursing assistant or a personal support worker, and a point of great error onto families, because families provide a lot of care. So it's not just a critical care unit issue or a hospital issue, it's across the healthcare system, that points of.
So, my dear friends, I stopped a little while. So, where we are stopping is when you are transitioning the order or giving over to someone, there is a great risk. A little after that, Michael also mentions about the role of the in charge on that day, because he says she was very supportive and she understood that this happened because of this is a very common thing that can happen when you are a young nurse in the critical care. You don't want to be seen less competent, because I have gone through that phase myself. Sometimes I call it as being little overconfident, that I can't make a mistake. But please remember, we all are human beings and we can make a mistake. So God help us that we don't make any mistake by mistake the way that Michael did. But he admits that he could have prevented it. The little voice was telling, there's something wrong, but he did not check the order. This is 1985, when we did not have double check for high alert medication. So today, when you give potassium, you're supposed to have double check. And we'll be talking about this on 12th of August, same time, medication safety in high risk situation. And what does WHO talk about it? Okay. Thank you, everyone, and stay safe and stay positive. And if anyone has any question, I would be happy to answer that. Thank you so much for being here. And we still have 125 people here. So what I will do is I will say thank you and I will stop recording, so that if anyone wants to ask a question, they can. So I'm going to stop the recording. Thank you very much, and see you all on 12th of August, 7:30 p.m. same time.